Hello, my name is Dr. Craig Childress. I'm a clinical psychologist in Pasadena, California. I specialize in treating children with ADHD spectrum issues, angry oppositional behaviors, family relationship problems, marital issues. And today I'm going to talk with you about how to treat a child with ADHD naturally, which means without medications. And for me, working and specializing in ADHD, one of the things I've come to understand is that ADHD is not a unitary phenomena. There's a number of potential different causes for the behaviors that are classified and diagnosed as ADHD. They can be relationship-based, trauma-based, genetically based, sensory motor processing issues. And so one of the fundamental first steps in treating a child with ADHD is to understand what's causing the behavior. Behavior and emotion are symptoms. The underlying cause is the brain, so we'd want to look at the different brain systems and how they're working together and what seems to be going wrong in those brain systems that is producing the hyperactive behavior or the inattention. A couple of general kinds of domains that I typically find in my practice, my clinical practice, is problems in sensory motor integration, sensory motor processing, particularly around a couple of sensory systems, one called proprioceptive, the other vestibular. And so in my clinical practice, I will do sort of a screening assessment of the sensory motor systems. And if there's any indication that that could be a factor in the ADHD, I'm going to want a really good occupational therapy workup. That can do wonders for a number of kids that I've worked with when that's been the issue. The second issue is a lot of the kids I see with ADHD, it's essentially an anxiety issue. And the anxiety is emerging off disruptions in the relationship systems. And so, again, it's important to understand what's going wrong with the child, because by treating the relationship systems, and particularly in relationship communication, emotion connections, we can actually treat the underlying anxiety and help resolve the inattention and hyperactive behavior. If you think about it for a second, what are the symptoms of anxiety? A difficulty focusing, a difficulty paying attention, restlessness, an activation of the body. Those are kind of the symptoms we see with ADHD. And so understanding the underlying cause is essential to treating the ADHD behaviors that we see. There are some indications that allergies for some kids can be involved, and so for some parents may want to look into those sorts of things. There's food additives and that type of issue involved. In some cases, diet, and it's always good to have a healthy diet. It's always good for everything to have a healthy diet. And so there's broader perspective on things that can also be done. But my first and foremost recommendation is to get a good psychological workup of the underlying neurological systems that are involved so we can target the right system for treatment. If you'd like more information about this or other areas related to child development, you can visit my website, and thanks very much.